So this is a 77-year-old female who came to my office complaining of neck pain, numbness in the left fourth and fifth digit, short-term memory loss, difficulty sleeping, so she gets mind racing at night, difficulty making decisions, and planning. She came in with the following diagnostic test already done. So she had an MRI done of her cervical spine, which revealed a C5 and C6 pyramidal narrowing. She had a brain MRI performed that also turned out normal. She had a sleep study done, which confirmed the diagnosis of central apnea. Her exam findings were she was able to repeat a story with 90% accuracy. She had decreased arm swing bilaterally, but more so on the right side. She had bilateral grade 2 finger tap, saccadic intrusions in horizontal and vertical pursuits, left myotic pupil. Reflexes were 2+, except for the right patella, which also had spilling, and she had a pretty pronounced right head tilt. With that head tilt to the right, as you can imagine, she had a left C1 subluxation, which is the location that she was pointing to for neck pain. So I believe that, or initially, and also confirm that with that right head tilt, if we could resolve the head tilt, that chronic C1 subluxation would also improve. And that did in fact happen. We performed saccadometry. The initial reading for position was hyperometria, as you can see to the right. So if you look at the green lines, normal should be, all these lines should end between 18 and 22, and you can see that the green lines, which are the saccades to the right, go beyond the 22 mark, so they're hypermetric. The red lines, which are the eye movements to the left, are mostly within a good range. However, we do have a number of them that are short or hypometric. Looking at latencies, her latencies are actually not too bad. So normal is considered to be between 100 and 200, and you for sure want them to be under 250. She does have some that are between the 250 and 300 range, and even a couple that are beyond that. But for the most part, she's really not bad. The majority of her saccades have a good latency, meaning that her reaction time is good. Let's go to the next two graphs. Looking at velocity, you can see that she has quite a bit of velocity. I mean, she goes way up there to about 650, which is very fast. Now, this is a 77-year-old female, and we can say that these peaks, these alps that she has for velocity curves, could certainly be associated with that mind racing that she has. So what we want here is we want to have a nice bell curve. So we want those peaks to be rounded down. And also, if you look down at the end of the curve, all the way down, or lined up with that 100 millisecond, at the end of her saccade, so at the end of her movement, her ability to maintain fixation there is not very good. So you can see that the lines go beyond the 0 mark, and then they come back up. So ideally, you want your eyes to be able to just stop on a dime right on that 0 line. So looking at her phase profile, you can see on the inside of the curve there's quite a bit of, we can call it rain, so there's lines on the inside. It should be perfectly white on the inside. And this is another location where here, the graph where you can see the hyperometria. So again, it should be between 18 and 22. So let's go down to our treatment. This is what we did. Initially, I actually started with complex movements on the right side and transitioned to complex movements bilaterally. She now actually is to a point where she does it standing, and she does the cross pattern complex movements, which is really helping with her balance and her coordination. But also gaze stability exercises were performed. All these were done, multiple times a day. She did yes, yes, and no, no gaze stabilizing exercises in the 5-dot star pattern. She also did the Carrick right brain exercises, remembered saccades, and anti-saccades. So let me just quickly show you in Focus Builder the exercises that we did. So these are in the combination saccades and pursuits, these are the Carrick right brain exercises when you see the target move up and to the left in a diagonal plane and then back down and to the right. So I had the patient do the complex movements first, and then the gaze stabilizing exercises, and then she would do the right brain exercises. So following that, I also, not initially, but once her eye movements improved, I had her do some anti-saccades and some remembered saccades. And so the remembered saccades look like this. We're going to have 3 targets appear. So you start in the center and you look at the appearing target and back to center, then to the second target and back to center, and to the third target and back to center. Once this disappear, you close your eyes and you repeat the exact same motion but with your eyes closed. And once you've done that, then you can mirror the targets to the other side of the screen, and still with your eyes closed, you imagine that now the targets are in the mirror location, so on the left side of the screen, and you repeat the exact same sequence. And then you can also, for an added layer of difficulty, you can reverse the order. So you can do them in order, and you can reverse the order in the proper appearing location and then in the mirror location. I also want to just quickly show you another variation, because as patients get better with this, it's actually good to change it up a little bit. In this case here, I'm just going to make the dots appear on the upper right quadrant. Okay, so we look in the center and then look at the first appearing target and back to center, and then the second appearing target and back to center, and third appearing target and back to center. So they're all in the same quadrant. So what you can do now is close your eyes and of course repeat the exact same motion you just did with the eyes open, but with your eyes closed. So you're imagining it, and then you can flip the location of those targets to the left side, the left upper quadrant, and repeat it. And then you can then flip those down to the left lower quadrant and then repeat the motion. And this is all with your eyes closed. And then you can flip it to the right lower quadrant. So you keep flipping it like that in your head, and that really works your working memory in that dorsolateral prefrontal area. And this has been a really fun exercise for this particular patient. Another good dorsolateral prefrontal exercise are the anti-saccades. And with anti-saccades, you look at the center dot here and you get an appearing dot either to the right or to the left. So when it appears to the left, you want to look at the mirror location on the opposite side. And when it appears to the right, again, it's the opposite side. Now you can turn on the go, no-go option or leave it off. If you turn it on and you have an appearing image that is not a red dot, then what you would do is you would not look in the opposite location. So right now it's on, so we see characters are on, so let's go back to it. So if it's a red dot, you look in the opposite location and back to center. And if it's a different character, like we just saw a baseball, then you would keep your eyes in the center and not move your eyes. You would maintain that fixation. Okay? So back to our case. That was the treatment. She did very well with that. When we did her re-exam, her planning and decision making was much improved. She feels a significant improvement in how her thoughts are organized. Her sleep problems are also improved, but not completely resolved yet. I do think there were some other issues that needed to be addressed in this case. Neck pain is resolved. Head tilt is almost completely gone. And her chronic left atlas subluxation is also gone. Finger tap is much faster. Arm swing is much improved, and her memory is improving as well. Back to that atlas subluxation there and that right head tilt, I want to know that it was very hard for me to resist not adjusting her atlas. So I couldn't, and I went ahead and adjusted it. She felt better when we initially did the adjustment, but pretty quickly started developing headaches. worse headaches or different headaches than what she initially complained of. And so I had to stop adjusting her and finish correcting the head tilt with the neurological exercises, and the subluxation resolved and the headaches went away. This was a good learning experience for me. Now, psychometry was repeated, and here we go. We can see the position profile. She is significantly better. You can see the right and left eye movement, so right and left saccades, which are green and red, run together. They're both equally metric. And however, we still do have a little bit of hypermetria. Now, this time it's a little bit more so with the left or the red lines, but much, much better than the original test. Now, let's look at the latencies. Latencies were good, and they're still pretty good, so not much to say about that one. Let's go to velocity. With the velocity, you can also see significant change here. It has a much more rounded peak. Now, looking at that that fixation point, so the postsaccadic movement is still occurring with the green line, so to the right. So that's definitely something that we need to work on and clean up. But when you look at the phase profile, you see there's absolutely nothing on the inside of the curve. It looks much cleaner, and all these saccades run together. So I hope you found this useful, and that you can use some of these tips with